Approximately every year in the United States, 172,000 individuals are diagnosed with some sort of blood cancer, whether that be myeloma, lymphoma, or most commonly leukemia. And if you do the math on that, that means about every 3 minutes, someone in the United States is diagnosed with some sort of blood cancer. And today I'm here to talk about leukemia. Like I said in the beginning of the video, leukemia is a blood cancer, which basically hinders production of healthy leukocyte cells and white blood cells. These white blood cells are important to us because they protect us from any foreign pathogens that enter our body, by engulfing pathogens and bacteria to help us fight any common colds and flus that we encounter. As many of you know, blood is produced within bone marrow, which is a prime target for leukemia cells to grow and metastasize throughout the lymphatic system within your body. Leukemia produces these cells called leukemia blasts, which are cancerous cells which can be found all over the body. Common areas of spreading for leukemic blasts occur in your liver, your spleen, your lymph nodes, your testicles, and even your cerebral spinal fluid. Once a healthy cell undergoes leukemic change, sadly enough, it can actually outlive the healthier cells. Leukemic cells will continue to grow until there are no more healthy cells left in the body. The rate at which healthy leukocytes are replaced by leukemic blasts all depend on the type of leukemia. There are 4 common types of leukemia. 4 common types of leukemia are ALL, AML, CML, and CLL. ALL, which stands for acute lymphocytic leukemia, is a condition in which abnormal white blood cells are produced within the bone marrow. So it could be either really low or really high. The process of ALL involves the replacement of healthy lymphocytes with leukemia cells. It causes various complications of spreading and replication of leukemia cells throughout major tissue components of your body, such as your brain. Statistically speaking, ALL is commonly diagnosed in children who are under 15. AML, which stands for acute myeloid leukemia, is a condition in which white blood cells don't have the ability to fully mature. And without healthy white blood cells, the body is very, very prone to any infection. Since both AML and ALL are acute diseases, this means they metastasize throughout the body much more rapidly than chronic diseases. For example, CLL, which stands for chronic lymphocytic leukemia, is a slow-growing leukemic disease which can occur throughout years without the person actually even knowing that they have it, until it actually gets really worse. Since CLL has a slower metastasized rate than AML and ALL, early onset symptoms are a little bit different than the other diseases. Most commonly, patients diagnosed with CLL will experience swelling of the liver and the spleen. And this is due to abnormal growth of lymphocytes. And finally, CML, which stands for chronic myeloid leukemia, is just the slower growing version of AML. Early symptoms of leukemia can be indicated by poor blood clotting, swollen liver or spleen, getting sick easily, because since white blood cells can't fight pathogens correctly because they're not fully mature. There could also be an increased amount of white blood cells because there's an overproduction. If an individual with this condition gets a cut or a small laceration, their blood will appear more lighter than usual. Not only could there be a shortage of white blood cells, but there could also be another shortage of red blood cells. And this condition is called anemia. Individuals diagnosed with anemia have a lighter skin color. It'll look more pale because of the absence of red blood cells. Other symptoms include shortness of breath, easy bruising, swollen lymph nodes, and also mouth ulcers. Patients diagnosed with leukemia are advised to watch out for several risk factors that could further complicate their disease. Patients diagnosed with CLL or chronic lymphocytic leukemia don't typically respond well to any flu vaccine due to a malfunction in their white blood cells. Some forms of leukemia actually don't really work well with chemotherapy, so doctors usually advise people who develop side effects from chemotherapy to find alternate ways of treatment, such as blood transfusions. And the reason for this is because chemotherapy can actually inhibit the symptom of anemia. And anemia, remember, is when red blood cells are actually being depleted. And when red blood cells are being depleted, that means there's less oxygen. Leukemia patients actually have multiple options to choose from when it comes to treatment. The most common form of treatment is actually chemotherapy. And chemotherapy is when strong medicines inserted into the body. It could be in a pill form, it could be inserted intravenously, or injected. And those strong medicines reach out to cancer cells and destroy the cancer cells during mitosis. Although chemo is one of the most effective treatments, it also has the most side effects. Chemo patients actually have to endure vomiting, upset stomachs, loss of appetite, feeling nauseous, constipation, and even having diarrhea. Stem cell transplant is actually a process that usually takes place after chemotherapy, and patients who undergo this procedure can actually replace cancerous bone marrow with healthier bone marrow. Radiation therapy can serve as an alternative to chemotherapy, and radiation basically focuses X-rays onto certain parts of the body where there's a huge concentration of leukemic cells. And the X-rays will actually try to eliminate any leukemic blasts around a certain concentrated part of the body. If a patient doesn't prefer any of those other treatment options that I listed, they can always resort to biological therapy. The thing with biological therapy is it is the longest process because it doesn't work as fast as any of the other treatments, but it has the less side effects. Biological treatment actually works in similar ways as a vaccine does, because the medicine or the vaccine is actually injected, and the point of the vaccine is to train the individual's cells to actually recognize leukemic blasts so they can actually kill them on their own. Most leukemia patients are actually diagnosed through a simple blood test in which the blood sample is actually sent off to a hematologist, and the hematologist will actually count the ratio between red blood cells and white blood cells. And if there's an abnormal amount, the doctor can determine which type of leukemia you're actually diagnosed with. Pathologists can actually use bone marrow aspiration and a biopsy to determine if you actually have leukemia by extracting a sample of your bone marrow and some fluid by analyzing it. It's actually a minor procedure, so they'll actually grab samples from either your femur or your pelvic bone. Patients could also be referred to a CT scan or a CAT scan, and these imaging tests could actually aid in helping out doctors figure out the causation of the leukemia. Spinal taps is another small procedure that could also aid in the diagnosis of leukemia. This is where the doctor actually inserts a needle to extract a sample of your CSP, which is your cerebral spinal fluid. CSP will be sent off to a lab and will be examined under a microscope to determine the makeup of the fluid. There are numerous possible causes for leukemia, but just like any cancer in general, high exposures to radiation can always lead to some sort of abnormal cell growth, as well as smoking cigarettes, and anything labeled as an endocrine disruptor can attribute to any causation of cancer. To be completely honest with you, the future for leukemia treatment and research has a bright future, and that's thanks to various organizations such as ACS, American Cancer Society, and also LLS.org, which stands for Leukemia and Lymphoma Society. Those organizations contribute all their donations towards patients and families in need for leukemia treatments and all that stuff. So if you guys are interested in donating and supporting, I'll provide a link in the description so you guys can donate a couple dollars to help these families and patients in need. Hey guys, that concludes my presentation for leukemia. I hope you guys enjoyed it, and thanks for watching. Myeloid leukemia is just a slower version of